Today my speech is on what I find to be a very important and valuable topic of strokes. During my time of talking with you, I will inform you on how to recognize signs and symptoms, respond to the signs and symptoms for the best outcomes, and lastly, ways you can prevent a stroke by making some changes in your life. A stroke is a disease that affects arteries leading to and within the brain. It is the third cause of death in the United States behind diseases of the heart and cancer. There are different types of strokes, but all types can be devastating not only on their survivor but everyone who cares about them. A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or burst. When that happens, part of the brain cannot get the blood and oxygen it needs, so it starts to die. When blood flow to the brain is impaired, oxygen and glucose cannot be delivered to the brain. Blood flow can be compromised by a variety of mechanisms: blockage of an artery, hardening of an artery, or rupture of an artery. When brain cells are deprived of oxygen, they cease to perform their usual tasks. The symptoms that follow a stroke depend on the areas of the brain that have been affected and the amount of brain tissue damage. Small strokes may not cause any symptoms, but can still damage brain tissue. These strokes that do not cause symptoms are referred to as silent strokes. According to the U.S. National Institute of Neurological Disorders and Stroke, there are 5 major signs of stroke. 1. Sudden numbness or weakness of the face or arm or leg, especially on one side of the body. 2. Sudden confusion or trouble speaking or understanding. 3. Sudden trouble seeing in one or both eyes. 4. Sudden trouble walking, dizziness, loss of balance or coordination. And 5. Sudden severe headache with no known cause. If a person has a stroke on the right side of the brain, it will affect their left side, and vice versa. So as you can see, depending on what side of the brain the stroke is on, it'll affect the opposite side of the body. What should be done if you suspect someone is having a stroke? If you suspect that someone is having a stroke, you should act fast. F. Face. Find the person and ask the person to smile. Does one side of the face droop? A is for arm. Ask the person to raise their arms. Does one arm drift downward or to the side? S. Speech. Ask the person to speak a simple phrase. Does the speech sound slurred or strange? T is for time. If you observe any of these signs, it is time to call 911. For the 6 million stroke survivors in the United States, acting fast was even more crucial because there is a risk for an additional stroke. For every minute that the brain cells are deprived of oxygen during a stroke, the likelihood of brain damage increases. And treatment is more effective if it's treated within a certain time frame, usually within 3 hours. If a person is affected by a stroke and you're waiting for the ambulance, you should ask the person to lie flat to promote an optimal blood flow to the brain. But if drowsiness, unresponsiveness, or nausea are present, the person should be placed in the rescue position on their side to prevent choking should vomiting occur. There are many treatments out there that can improve the outcome of a stroke. Once the person arrives at the hospital, they are often treated with several medications such as heparin, aspirin, and then there's the miracle drug TPA, which is a clot-busting drug that breaks up the clots that are anywhere in the body and can improve blood flow. TPA has to be given within 3 hours of the onset of the start of symptoms. In a few strokes, there can also be a catheter placed in a vein or an artery to reopen it for adequate blood flow in the brain so they can have some recovering. When the patient is no longer acutely ill after a stroke, the healthcare staff focuses on maximizing the patient's functional abilities. This is most often done in an inpatient rehabilitation hospital or a special area of general hospitalization. The goal is for the patient to resume as many, if not all, of their pre-stroke activities and functions. Up to 80% of strokes are preventable, yet more than 700,000 Americans suffer stroke each year. There are many steps that you can take to prevent a stroke. The possibility of suffering a stroke can be significantly decreased by controlling these risk factors. The most important risk factor is high blood pressure. When a person's blood pressure is persistently too high, roughly greater than 130/85, the risk of stroke increases in proportion to the degree by which the blood pressure is elevated. Controlling blood pressure through diet and exercise and medications, if needed, will decrease your chance of having a stroke. Second is smoking. The risk of cigarettes and tobacco use causes carotid arteries and develop severe arteriosclerosis, which can lead to the closure and the block of blood flow in the brain. So if you smoke, stop. Smoking doubles the risk for a stroke. If you don't smoke, don't start. And by quitting today, it will reduce your risk immediately. The third one is diabetes. If you have diabetes, it causes the small vessels to close prematurely, and when the blood vessels close to the brain, small strokes can occur. So good control of your blood sugar is important in decreasing the risk of a stroke through diet and exercise and medications with your doctor. Another consideration is if you drink, do so in moderation. Studies now show that drinking up to 2 alcoholic drinks per day can reduce your risk of stroke by about half. More alcohol than this each day can increase your risk of stroke by 3 times and can also lead to liver disease, accidents, and more. So if you drink, it's recommended that you don't drink more than the 2 drinks a day. So remember, if you have any stroke symptoms, seek immediate medical attention. These include sudden numbness or weakness of the face, arms, or legs, especially on one side, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, or sudden trouble walking, dizziness, or a headache that you have no reason to have. If you experience any of these symptoms, or you have had a TIA or a mini stroke in the past, you need to seek help immediately. If you think someone is having a stroke, act fast. Do the simple test. Face, have them smile. Arms, raise their arms. Speech, can they talk? Time, call 911. My goal of this speech was to raise public awareness about stroke risk factors, prevention, symptoms, recognition, and acting fast so you could save a loved one's, a stranger's, or even your own quality of life. May is National Stroke Awareness Month. Will you make a difference?